Hello, Pedro. Good morning.
Hello, good morning, Johannes.
The whole weekend I was looking forward to this podcast, to this call, because you were
Uh-huh.
so positive the last time. I really liked our previous conversation, so I was looking forward to it. How was your
Well,
weekend?
if you know that if you're not trying to be positive in your life, you're going to live less and worse. No, so
Yes, yes. May I ask how old are you?
I'm 64.
64. And you still have the all this energy to start the longevity business in Spain and try to influence the world. It's nice.
Yeah, of course. This is my moment because I
This is
have
your
accumulated so much experience
hmm
personally and professionally. No? And this is
Yeah.
what gives you the strength, to say, okay, no, this is the truth, no, that I have discovered.
Then let's start. Today with us on the show is Dr. Pedro Luis Gonzalez, who is a leading figure in the longevity and medical authority space in Spain and in Europe. And he has worked in preventative medicine for all his life. So he will tell us more about that. But I'm very happy that you are with us today. Hi, Pedro.
Hi, Johannes. Thank you very much for inviting me to this fantastic podcast you have.
Yes, that's good that you're here. So I told you, and I will tell the audience, was very much looking forward to this show, since you were very positive and enthusiastic about the longevity and preventative medicine space. So maybe we start very easy. So who are you? What are you doing? And what's your current role?
Okay, so well, I'm a physician specialized in preventive medicine, and I have a long trajectory in my field since more than 35 years, practicing it in different sectors and fields. I have been working in all sectors of healthcare, beginning, of course, from hospitals, clinics, but also in pharma industry, insurance industry, and even some consulting services to the government. So I have a pretty wide view of how the health system are behaving, where are they failing, and what do we need, to fix them. And what I'm doing now, after a long, a long career and seeing what were the needs of people, because this is what is important at the end. No? I discovered that the healthcare system we have now is not directly directed to help people thrive, but instead is directed more to keep a business of diagnosis and therapies. No? And it doesn't matter a lot if the person is not curing themselves, because what they are doing now is not going to the root cause of disease, but instead just treating symptoms, no? Creating, as I say, cautive consumers. So from my preventive medicine point of view, I'm very happy at this moment in life because I've also made a big transformation from the disease care to the healthcare, the real healthcare. And I think that we are in a very sweet spot now because there are so many discoveries and technologies and scientific advances that are telling us that we can tweak our biology for the good and for the better, that that I'm very happy for this. No, and this is my main message for the audience and for all the people I direct. That's okay, saying that yes, you can uh, tweak your biology to make it work for you as it was conceived at the beginning. No? Because one of the problems that we have been facing is that our life, especially in Western countries, our life has been structured along activities that are given the or going against our biology. No? So we get up with artificial light, we go to bed with artificial light, especially even in the southern countries like Spain or Italy in the Mediterranean area, we don't see so much sun, no? Because we get up with artificial light and go also to bed with artificial light. We are not following our natural cycles of life, and And this, together with the continuous stress in our works, competitiveness, and the bad eating through sparse times, of eating, and also as, products, ultra processed products, and convenient food. This has made that in the last decades we have a very big epidemic of chronic diseases. And this is what we are facing now. And our healthcare system is not able to tackle this because we, for example, I think it's pretty more or less the same in the whole Europe, but in Spain, for example, during the adult life, nearly half of the population has one chronic disease, but when they arrive to 65 or more, 80% of the population has a chronic disease. And this is because of our lifestyle. It's not any other thing, no? It's not maybe, well, of course, the environment also plays a high role, no? Pollution and all the toxics that we are drinking and eating through food also plays a big role. But the good news is that we can change this, no? And we can change this in two aspects. That this is what I'm questioning now in Spain. I'm creating a community around scientific longevity with two aims, no? Making aware people of the system, or the way we have structured our life is not the best one for us, and we have to fight, even with our governments, to change this. For Spain, for example, we have a big fight still with the time. No, you know that we should be in the same time as the UK or the Canary Islands that are ours, but we are living 2 hours ahead of the sun. Now it's summer, and 1 hour ahead always during the winter, and this is not good for our natural cycle, But and we can fight also, for example, with the children, We are claiming there is a strong movement now in Spain asking to schools to begin later, because this way the children can get up, can see the sun, and they can go with a good breakfast to the school instead of being there since 8 a.m. until 5 p.m. like workers. No, they are not workers at all. Still,
Yeah.
It's also, this is another podcast that we could make about education.
100%. And I'm optimizing sleep myself. So light, circadian rhythm, and so on are things I'm personally interested very well. And I totally agree with you. Light has a big impact and rhythms have a big impact. So I see this. You mentioned that the healthcare system in Spain, but all over Europe, is very broken, focused on sick care treatments. What changed? What signals did you see in the last years which motivated you to change this now? Or asked differently, why didn't you start 30 years ago? What are the trends at the moment which lead you to your decision to move now into this direction?
Well, this is very, very old in my personal life, because even since I was a student at the Faculty of Medicine, I thought that my main mission would be to not exist, or to not be needed for people. So just when I was very young, I thought about it. But then when the development of my career, I saw how hospitals were working. I saw how people were aside of the decision-making process, for example, and I began taking this view of very patient-centered, And well, this is something that I should mention. I've been working. I am also a journalist, scientific journalist, and I've been working in a daily newspaper in Barcelona for 6 years. And during that period, I learned a lot. Those other things that in a medical faculty you're not taught about, And this is how they live and experience, how patients experience the system, And after that, working for the pharma industry, I saw the great need that people have to be taught how to use the drugs, because it has no use. If for example, doctors, we are prescribing antihypertensives, but then if you look at the statistics, after 1 year, only 30% of the people continues adhering to this medication. They don't know how to use it. They don't know how they are making something in their bodies, no, with these drugs. So I saw that in the pharma industry and also in the insurance industry, where I collaborated a lot to create programs for support of patients with chronic diseases, especially, the adult diabetes, the pulmonary problems and the cardiovascular problems, but also creating platforms for health and well-being, because it was supposed that an insurance company is the first interested in keeping their clients healthy, so they don't use the services. But you discover it's incoherent, but you discover that the real need is to keep this cycle of diagnosis and therapies going on, not so much this. No, so I arrive at the end of my professional career. Well, it's not the end. I'm still making things new. But in the last years of my professional career, I decided to dedicate myself to send this message about how our biology has been silenced. Not because anyone has been conspiring, thinking about, I'm going to silence the biology of the world population. No, has been a result of our evolution. But what we have to do is to think about it, and to say, okay, this is not the right way to go. No, we have to stop and change things. And now I'm dedicating to this, and also helping people to find the best way to have more years and add more life to these years, because there are authentic discoveries and innovative therapies going on in the world that for sure are going to help us in some 1 or 2 decades, are going to help us to arrive well at the 100 list.
Yeah. And how do the patients, how do the users, maybe we should call them users, not patients,
yeah,
how do they react to this new possibilities? What trends do you see with them?
Well, this is striking, because I see a big difference between the 50 plus and the youngers. The 50 plus are still very involved in this belief, in this frame of belief, that okay, it's not possible to change anything just with lifestyle or with or taking some supplements or senolytics or this kind of new therapies that are going out. And it takes a lot of time not to change their mindset. But the youngers, I'm really unhappily surprised, because I'm having people in the 30s very anxious and very worried about their well-being and how to keep this for the future, because also this is a thing that they see that they are not going to have as their parents a strong family network supporting them when they are old. So they want to arrive to the oldest ages with more autonomy and also being able to be by their own.
Mm-hmm. Mm-hmm. Yeah, I see this. So with all that information about the system, about the users, can you describe how your current approach to longevity is looking like? What are you building, and how can I imagine your work at the moment?
Yeah. Well, my approach is a very simple one. It's just preventive precision medicine. I put this adjective of precision because we now have technologies and analytics to know with years of anticipation how things are going on in your physiology. We can detect diabetes, pre-diabetes very, very soon, and we can detect also low-grade inflammation and all this stuff that is making us silently ill, with the years. So after practicing this analytics that I study more or less more than 80 biomarkers in one analytics, I join it with, and these biomarkers belong to the genetic field, to the proteomic biochemistry field, and also to the lifestyle, which could be the phenotype. And joining all this together, I can make a completely personalized plan, which at the end is overall lifestyle changes. And many times don't need very complicated or or, or things that you have to especially do. Just make a little tweaks in your habits, in your daily habits. You know, for example, we were talking just some minutes ago about going out to the lights. You know, and this is something that if you do, you have 50% of your health for the day completed. No? So this is what I provide to my clients, and also to those that are interested for it, especially this is a demand that I have for the 50 plus, no, that are interested in going to have more years, no, because they see that the end of the life is approaching and they want to live more years. And then together with them, and depending on their situation, we plan specific therapies to go either in Spain or in Europe or even in the United States. No, it depends on how want or how daring they are in taking approach to these new therapies. But at the same time, through my community, what I try is to make the population aware about this problem of structure, no? Because what the system is giving us an alternative to this sick care, healthcare, um, is to convert in heroes people. No? Nowadays, it seems that even though you have to wake up in the without seeing the light and to work even 10 hours a day, no, you have to go to the gym. You also have to keep your diet on track. You cannot stress a lot, and you have to be a hero for this. And this is a problem, and people cannot make it. And there is a very big industry that has gone out around habits, no, how to change your habits and so on. And okay, of course, this is good, but this is asking people to do what they cannot do. No,
Mhm.
it's like asking a depressed person to be happy, or or a drug addict to not take drugs. No, it's
Yeah.
like okay, I cannot do it. No, give me something more. And the problem is this frame we have. No, we have to change the frame we are living, and until the whole population is not aware of this and has a conscious will to change all this way of living, the problem will be always the same. No?
Hmm. Yeah. So let's talk a bit more about this company. So where do you want to bring it? What is your vision for it? What would be the ideal goal you want to achieve?
Well, my vision is to create a very big community of people conscious and wanting to change things in this way, you know, and claiming to have more rational timetables, more rational way of living, that it can be done without losing productivity or winning things, and also these people to be aware of what we have in the industry to help them, how they can help themselves, and also to learn to distinguish between the hype and the reality. No, there is now at this moment. I was telling you that we are in a sweet spot because we have a lot of discoveries and news around longevity. But the problem is that the marketing is taking some of them without proof enough and making hype around them. So many people are just seeing things in Instagram on the social media and all saying, okay, maybe it's good to have a cold plunge every day, no? And this is not proved at all, no? It is good in some cases. It has been proven that it's beneficial from some um, diseases or entities, but not at all for everyone, no? You have to study first with a professional if you're going to benefit or not. And or for example, the supplements. No, it seems now that everything ends in a supplement. This is the marketing funnel they use. No, and there is no supplement that fixes everything or that fixes just the specific things. It depends on how your physiology is working and how you are using your genetics. And and the good thing is that we all have our genetics. We only have to learn how to use the genetics better, so we can arrive to an old ages without without feeling old and in the country feeling young.
Mm-hmm. And to scale this to this bigger community and to more people precisely treating or preventing, where do you see the main challenges into scaling it like that? So what are the hurdles for you?
Well, the main challenge to scale these things, especially among the youngsters, because they are very online oriented, is to tell them to go to a laboratory and have a blood extraction. No? This is something that it takes time because they have to think about, they have to pay for it, and they have to think about. And normally, these analytics are not cheap because what I use, for example, is not the typical analysis that you are ordered in the healthcare system. It's analytics that, as not so many people are using them, they are more expensive. So this is the first step for me, you know, that, but they can also learn a lot of things to do without really knowing what's going on.
Mhm.
The thing is that I think that there are technologies that nowadays are evolving and are being able to tell people through digital means how they are in their physiology, no? And it's a question of time to
Mhm.
to demonstrate that these technologies also serve the same as traditional analytics in blood or in saliva or the genetic one.
Mhm. And do you think the technology will switch from a physical more to a digital world, or you think is more complementary?
Well, it depends. No, for example, if we are talking about preventive, I think that the switch to digital is a need
Mhm.
because when you are preventing, you are healthy, and you don't need to feel like, okay, I'm ill, I have to go to a clinic and see a doctor with a white coat and that's all. This is normally I wouldn't like to do that, no, because I don't want to feel ill, you know, and
Mhm.
I want to be treated as a client, as you said, no, better than a patient. So I think
Yeah,
that
I like this. I like this paradigm shift already. Yeah, nice.
yeah, this is a shit paradigm, and because I always tell, for example, in my clinic, when I see people, we always sit in sofas, one in front of other. We don't go to a table. We don't put a table between us. And I always say, okay, we are going to call the if equal from equal because the only difference with me is that I have more knowledge than you in this field, and I'm going to be your guide and to make you advice, no, around it. But you are the one that has to make the decisions and the actions. I cannot work out for you.
Mhm.
If this was the solution, it would be very easy to treat patients because I only have to go to work out and they are all happy, no? But
Mm.
this is not the reality, and this is a shift paradigm, you know, from patient to client, and in preventive terms, I think that if we are able to provide digitally all what
Mhm.
they need, no, to see, for example, how am I now today? No, you have a technology that is going in this way through your app, and I think that if we are able to tell them, okay, this morning, better if you don't exercise a lot because your heart rate variability is not in the best shape because you haven't slept at all, or something like that we already have. And but if we provide them and people understand it, this is the best way to keep your body in perfect conditions, which is
Mhm.
what we are designed for.
Yes. Yes. So if I would give you a magic stick and you could change one challenge or could remove one challenge you are currently facing, which one would it be? What would you do?
Well, the false belief that it is not possible to change or to cure anything with lifestyle through lifestyle. This is a false belief. We have a lot of research showing the contrary. We have the problem is that the healthcare system doesn't want it, no, because you cannot monetize as much the lifestyle change as a drug. You know? But
Mhm.
I think that this is if we change this false belief in the population, then they will ask their doctors for the lifestyle pill before the other one. No?
Mm-hmm. Yeah, thank you. So when we are looking at your business, on your vision, how you want to grow this community, how you want to serve your clients, when we need to break it down, what would be a success? Where do you want to be in 6 months or in 12 months? What are your goals for the next half year and a year?
Well, my goals for the midterm is to have this community going on and to keep at least thousands of people around it, and also
Oh, wow.
be able to present them with my. I'm writing a book about all this that we have been talking about. I don't know which title will be because it depends on the editor and all this stuff. But the main message is your silented biology. No, I don't know if English is yeah,
Yeah.
your silence
How
biology.
is the book called?
Sorry,
What's the
the
name of
book.
the book?
I'm calling it the silenced biology.
Ah, that's the name. Okay.
Yeah,
All right.
that's the
Nice.
name. But it will depend on the editor if they choose another title or something like that. No, you know. But it will be around this, saying okay, it will be. I will try to be very, not very technical, but just to show that okay, our healthcare system is failing for these reasons, for these scientific reasons, and we have other means to arrive and to achieve well-being during the whole life, and then this is what we have to do, no, and to provide some key questions, not only at the individual level but also collective level. Not to say, okay, we have to ask our governments to stop, for example, stop providing so much funds for diseases that which cure is done through lifestyle, no, or can be prevented through lifestyle. No?
Mhm.
We
Yeah.
are we are putting a lot of money. For example, I use always if you're in a river, no, and you see people drowning and coming from the riverside drowning, we are putting a lot of effort and a lot of resources in going and saving them, no, for drowning, instead of going up in the river and see why they are drowning there. No?
So I think in this podcast today, we've already learned a lot about your view on the current healthcare system, how we could change it. We've seen signals why people are moving more towards longevity, and we've clearly seen your idea of how to bring longevity to people at what point in time with the use of new technologies to make it available. Is there anything else you would like to tell your audience and our audience um, to take away from this podcast? Do you have any other main message you want to convey?
Well, I would like to finish just remembering and reminding that the change is possible at individual and collective level. Maybe at collective level, it will trigger more time, but at the individual level, you only have to make some little changes in your life, like sleeping better, being more active. I don't mean exercising, but being more active, and just eating as much single products as possible. No? It's not a question of what do I eat. You have to eat whatever you like, but um, being from natural sources and in single mode, no, not for example taking out all creams, sauces, and all this stuff. No, if you eat just a salad well made with olive oil and fish or poultry or even or meat, if it's good meat, that's a key to live better. No? And use also what our earth gives us. No, the legumes, for example, are very important, and don't lose it for the convenience, no, of processed foods that we eat very quickly because we have to work and we have to stop and to take our time for us. This is the most important message: to give time for us for our well-being.
I think that are wonderful words to close this podcast, and it it motivates me now go for lunch and have something healthy, because
Okay.
as a founder, time is always short, but we cannot leave out good food. Yeah.
Yeah, you can. As a founder, you have to learn that if you're not in well fit, not well fit physically, but well fit in your mind, in your physiology, and your sleep, you're not going to take good decisions. So you're not going to make things going well. So it's the success of your company depends on how well you live. This is
Yeah.
something very important. It doesn't depend on how much effort you put, but on how well you live and you make good decisions.
100%. So I'm really looking forward to your book, to how you build this longevity community, and happy to help you in any way with that. And yeah, Pedro, thank you so much for being on the show, and looking forward to your farther way in longevity.
Okay, thank you very much. And soon, I still don't have the URL for this community because it's not built, but it will be built in the same in the next weeks, and I will provide it to you.
Super. We will share it with the podcast. Thank you so much.
Okay, thank you.
You can stay. So I think podcast is done. Did you like it? Was it okay for you?
Yeah, it was okay. I found it very very fine. Sometimes
Yeah.
it's difficult for me to find the words in English, but
No, I think you did very well. I think so. You have a little bit of Spanish accent, but that's totally fine, as I have a German accent. But no, I think you did very well, and I hope I could provide questions where you were able to tell your
yeah,
story, tell your vision, because for me this is the most important thing, that you can convey this what you
yeah.
want to bring out. Is not for me to ask challenge questions or to, so I think
Yeah,
it
no,
was good
and
for
I
me.
didn't want to make a podcast just the typical podcast explaining what you have to do for lunch, or you have to, which kind of workouts you have to do, no, because of course this is another podcast, no, but in this one I wanted
Yeah.
to send this message of, okay, you have to wake up and see that you have to change. You want to live more and better.
Yeah, 100%. Super cool. I liked that you mentioned the technology. So I think in the pre-podcast you already said it a bit, but I didn't know how far you are with digital technologies. So
Well,
I think.
I've been working a lot in creating digital platforms for
Okay.
for wellness and also for self-care.
Hmm.
I've been working
Hmm.
in Spain in a health insurance company, the biggest one here. I built the health and wellness platform
Hmm.
for people, and also the program for chronic patients through just with courses through digital means. But also, I have been working with Adira Health in the United States,
Hmm.
building their programs around self-care
Hmm.
and creating a very nice algorithm that helped us to personalize a lot the messages we were sending to people.
Hmm. Hmm.
So I know how all these things work, and I'm fan of all technology that brings us the easiness for people to care for them, because
Yeah.
if you people are very they have a lot of responsibilities and very occupied the whole day, and if you ask them to do specific efforts for taking care of them, they're not going to do. This is what we're asking now.
Yeah.
We tell them, okay, you have to work until, especially in Spain, where the work hours are very long. There is a lot of presentism. People stay at home at work until 8 p.m. And then we
Hmm.
say, okay, after you go out at 8 p.m., you have to do your work, you have to attend your children, you have to. So if they have a digital mean to take care of them, to see how they are going on, I think it's.
Yeah. Yeah. So I don't know how far you've looked into what we are building with, or what I am building with youth. Would you
Yeah,
be interested that I show this to you a bit, because I think it's going in that direction.
yeah. I
So.
told you the other day that I found it
Mhm.
very, very precise because it's a way to, instead of sending people to an analytics, use this kind of technology. And if in this kind of technology you find something that is wrong, then you can say, okay, let's do another one. Yeah?
Yeah, this is exactly where we want to place it. So it doesn't replace a blood test or a doctor visit, but it's more this very accessible and easy point to screen. And when you don't find anything, it's okay. But if you find something, then maybe it's worth to take a blood test or to go to a doctor or do another diagnostic. So I think
I downloaded it and I have improved it. I've been
all
testing.
right, you downloaded it already.
Yeah, and then what I saw is that probably you have to make more aware or to advise more about the light, because for example, it gave me a bad hemoglobin, but then I took it another time outside, and then it goes back.
Yeah. So for us, light and noise is the main problem. So camera and different skin colors and so on is also not so much a problem, but light and noise is the biggest problem.
But I'm interested. We could talk about it maybe in the future, in the near future,
Yeah.
because I was thinking, okay, how could I introduce this as a service in my community?
Yes. So let's just schedule a call, and then we can go in more detail. So I can tell you all about the technology. You can ask the questions. We can spar about ideas how we could introduce it to your community, and let's see if maybe there is something. Thank you so much.
Thank you, Johannes. Bye.
Have a good day. Goodbye.